morning, very good morning.
Good morning, Father.
Very good morning, everybody. Shall we begin? Yeah, today I want to take you for a ride, okay, a special ride with us. Riding, 2 weeks of marathon writing sessions were going on, and beautiful sessions were handled by many of them. And as on now, still more sessions to come in. First of all, let's pray for 2 minutes. Let's surrender our OET journey into the hands of God. Especially remember all those who are really struggling financially, emotionally, and with a lot of their own circumstances. Let's surrender all of them into the hands of Almighty. And also those who have traveled recently to other countries. Let's surrender all our teachers who have taught us from KG classes till today. And all the institutions, pray for them all. Let's surrender our family members for making a lot of concessions or sacrifices so that we learn and crack OET. Amen. So once again, welcome back. A good morning to everybody. If you are from India or whatever the time zone you have, greetings of the day. And as usual, we are here to fall in love with OET writing. And today we'll be going with an experiment, maybe the first ever experiment in OET. We are trying to put in some method into the reading of case notes. And you know what is the case note today? So that it is Peter Dunbar. This is a case note from official OET website. Thank you OET for allowing me to use this for academic purposes. And so you must be familiar with this case note. Hope you have the case note, your letter, and a piece of paper with you. Okay, anyhow, let's apply a method now. Okay, come on now. I'm trying to apply the first method of reading into reading case notes. Okay, this is maybe first time in the history of OET, so we are lucky to be part of that. Now you have to interact and you have to tell me. First, F stands for foresee. Okay, as soon as the task is given, try foreseeing what is the task. Okay, let me just check whether I can share my screen. F stands for foreseeing. I stands for inquiry or investigation, you can say. Then R stands for reading. So first we are going to foresee what it is. Could somebody read this on writing task?
Using the information given in the case note, write a letter to the community health nurse in Centrevilla outlining the patient history and requesting ongoing monitoring. Address the letter to the community health nurse, Eastern Community Health Center, 456 East Street, Centreville.
So to whom it is to be written?
Community health nurse.
Community
It is to be written, yes. And next is outlining patient's history and requesting ongoing monitoring. Okay, what is that? That is the task. Purpose or task. What you are supposed to do. Your task is that. Writing task is that, right? That is a purpose. You can see the address, yes. And here I want to tell you, a couple of you have not written the address fully. The community health nurse, Centreville. Many of the things you have to cut and paste exactly as it is. And where do you find the main medical issue?
In treatment record.
So in the treatment record, you have diagnosed with type 2 diabetes, right?
Yes.
Yes,
And
Father.
this date, many have written this date different. Okay, 2018, 2017, this is clearly given here. Now let me know. Your task is to tell them to have monitoring, regular monitoring or ongoing monitoring, right? So now let's foresee what is supposed to be the content. Monitoring a diabetes patient, what are the things required? Could you just write down on the piece of paper that you have? What you can presume from your knowledge. Monitoring what? Monitoring a diabetes patient means monitoring what?
Diet monitoring.
Diet
monitoring.
Medications.
Diet
monitoring.
monitoring.
Medication.
Medication monitoring.
And the exercise.
You can put it exercise, okay, possibly. So, you know,
Complications.
probably we can foresee the letter might speak about the medication, diet, exercise, right?
Yes, Father.
Yes.
That is the main thing is to be noted in the thing. Now, having this in mind, we have to ask ourselves few questions. Diet, is he compliant or non-compliant? Okay. Also medication, is he compliant or non-compliant? And how is his condition as on now? Latest date, as per the latest treatment record, the case notes, what is his condition? So now it is reading, okay? Inquiry is over. We are asking many questions. What happened to him? What happened to him earlier? What is happening to him now? What is situation? Is it worsened or better or good or improving? Definitely then we go into reading, just reading the case notes. Somebody who can read audibly, please read it.
Assume
Read
that
it.
today's date is 22nd Jan 2019. You are
Yeah,
the nurse.
stop it.
in a-
You'll have to stop for me, okay?
Yeah.
Yeah, now this is today's date. That is the date that you have to write in the letter. You need not discuss anything. It will be clearly mentioned over there in the examination. So no need of discussion on that at all. The date will be exactly given and you know where to mention that date, before the address or after the address. That is clear, right?
Yes. You are the nurse in a community health center.
Okay, this answers who you are, right? What you require is?
Patient details. Name,
Okay,
Mr. Peter Denbar,
yeah.
and 18 March 1932.
Yeah, where do you write this information?
DOB.
Yeah, DOB. Now you see 18 March 1932. Those comma issues and all you can just avoid because this is the clearest way you can write. Okay, the Australian way and the British way with comma and without comma. There are two ways, but then don't worry about those things. Better not to discuss on those things. 18 March 1932 is fine. There's no confusion required. Okay. If the date of birth is given, normally you will have the age as well as date of birth. So you can write the age over here or date of birth, whichever, then you can go into purpose where if you want to mention the age, you can mention over there. But if the date of birth is given, never ever try to calculate the age of the patient, age of the person. Like that will lead you to different risks. One is if you make a mistake in calculation, you are giving a incorrect information in the letter, you will be graded low. A second thing is you are wasting your time. Okay, that's not required at all. Yes. Please continue.
Yeah. Current medication, metformin 500 mg TDS, oral hypoglycemic. Ramipril 5 mg daily, antihypertensive ACE inhibitor for hypertension. Warfarin variable 3 to 5 mg anticoagulant. Sotalol 40 mg daily for beta blocker.
Okay, is this important?
Yes, Father.
Yeah, this is important, but then this is repeated again in each record, treatment record. In each date, it is repeated. So you definitely medication is important. Why? Because we are asking for monitoring, right? So when you ask for monitoring, details of medication must be mentioned in your letter. Without that, the person who is receiving the letter, receiving the person cannot monitor or continue his medication because, as we said, they have to manage the diet, medication, if there is exercise, whatever, those things have to be managed. So you cannot monitor a person without knowing what are the medications being administered to that particular patient. Yes, continue.
Treatment record, September 2017. Diagnosed with type 2 diabetes, August 2016.
Okay.
Fasting blood sugar level 9.
Yeah. What is the key concept here? Anybody?
Diagnosis.
Yeah, diagnosed with
Type 2
Type 2 diagnosis.
Type 2.
type 2 diabetes. That is a key concept. I'll make you understand as you have topic sentence or keyword or key phrase in a paragraph, you will have key words or topic sentences or topic words in the case notes as well, which will guide you into different paragraphs. So you have the three things here: the diagnosis, the main issue, then the time, chronological order or the time. Three aspects are given in this one sentence. Yes. Continue. Yes. Fasting.
Fasting blood sugar level is doctor recommended dietary management, low fat, low sugar, calorie restriction, limit alcohol, exercise.
So recommended dietary management is important, right? Exercise. What about exercise? Since you mentioned diet, medication, and exercise, what about exercise?
Increase exercise.
Yeah, he is having a lot of exercise, or he is overdoing with his workout. Okay.
Patient lives at home with wife. Wife cooks, wife managing dietary requirements, but patient likes 2 to 3 glasses wine with meals.
Is it required? Is it relevant?
Required.
Hmm?
Actually, the wife has already decreased.
Not required. Not required.
Not relevant.
Not relevant.
Okay. This is not relevant because this is what I said in the first 5 minutes. Unless you read thoroughly, you will not be able to underline soon after the 5 minutes reading time what is relevant and not relevant. This is not relevant because as of now, he is moving with his daughter. Okay. All those daughter, this is outdated. We call it outdated information. So please don't use the outdated relevation. Always outdated case notes are irrelevant. Yes. Next.
December 2017, wife disease, patient depressed, grieving, and referred back to doctor for monitoring, medicating, fasting BSL 9.
Is it relevant?
Yes, we have to mention that because as the patient is now on non-compliance, so we need to just mention, not that much, but less important, but we need to just mention.
This is
this
is known as
Semi-relevant.
You can you can just mention this part. Wife deceased and is non-compliance. Okay, fine. Next.
March 2018, doctor prescribed metformin, oral hypoglycemic agent.
Yeah, what is the key word here?
Prescribed.
Yeah. Yeah, that's what I said. There is a sequence. Okay, there is a sequence that you have to identify as you are reading. Now, there is diagnosis, there is prescription, right? Yes. So is that important?
Yes, Father.
Yes.
Father.
Okay. The metformin is important. Then what about now patient cooking for self, non-compliant?
No need.
No need because that is outdated, and also non-compliant is a repetition, right? Already it is there earlier. We have taken it, non-compliance. See, when the wife died, he was non-compliant. We have taken it. So it's a repetition. So no need. Non-compliant with medication. Then please read.
Non-compliant with medication. Blames poor memory. Patient appears unmotivated. Resents having to take medication. Always been healthy. Takes medication intermittently. Encouraged to take regularly.
Okay.
Educated regarding need for regular medication and potential advice effect of intermittent dosing. Discuss strategies of memory aids.
Okay. Is this with diet non-compliant with the medication relevant? No, it's repetition. Again, repetition. If you want, this is semi-relevant. Blames poor memory is semi-relevant. You can mention it connected to something else. Patients unmotivated reasons recent having medication that is non-compliance, always been healthy. Those things are not relevant.
Relevant.
It's a petition or not relevant. And takes intermittently, that's again says non-compliance, right? Yes.
Yes.
Again, it is non-compliance, intermittently.
Intermittent.
Means she is not consistent in taking medication. Then these things are semi-relevant. Only if you need cover count, you can use it, otherwise not required. Okay, because this is also almost like outdated, because at the end he is still non-compliant or he is resistant to medication and diet. So all these educations have not helped him. Got it? That's why I said semi-relevant. Next,
June 2018, patient hospitalized, City Hospital, Newtown, with myocardial infarction following retrosternal pain.
Okay, now is this important?
Yes.
Fast medication.
Yes.
That's what I said. You should be very careful. You will have, most of the time you have a primary issue, main condition, main disease, and a secondary issue, sometimes even a tertiary issue. Okay, so this is also important. That's a secondary issue along with the diabetes, type 2 diabetes. Okay, now other things.
Following retrosternal pain, nausea, vomiting, dizziness, sweating, confirmed by ECG.
Okay, are these important?
No, Father.
Not relevant.
No, not relevant, because secondary and tertiary issues, you need not take all the details, because your purpose is to monitor type 2 diabetes. Only for them to get a general understanding. If there are some complications, you have to mention. Otherwise, these things are not essential.
Treatment, aspirin, streptococcus infusion, prescribed Ramipril 5 mg daily, diagnosed with atrial fibrillation, post-MI, commence sotalol and warfarin.
Yeah, if need be, this could be relevant. Yeah, this could be relevant in the sense, medication, when you are asking for monitoring, the other medication, if it is continuing, you have to form. Next one.
August 2018, patient attended twice weekly.
Is it required?
No, Father.
No need.
No, that's not required. Not at all relevant. Yes, next.
October 2018, patient now walking with a stick, signs of diabetic neuropathy, poor exercise tolerance, restricted mobility.
Now, is it important?
Yes,
Yes.
Father.
Third complaints,
Yeah.
Father. It's important.
Complication of diabetes.
Yeah. So
It's
this
required.
is a tertiary issue, or you can call third issue. Okay.
Yeah.
Main issue, secondary issue, tertiary issue. You'll have to mention. Okay, because that is a complication connected with diabetes.
Non-compliance with diet continues, still self-catering, discussed alternatives.
Yeah, is it relevant?
No need.
No need, not required, because diet continues. Non-compliance with the diet continues. That is repeated again, repeated. Right? You need not mention at all. It's already taken, right? When the wife died, he started non-compliance. Okay. Then at the end, you can mention still he continues the reluctancy with compliance of medication and diet. Example,
Community-based meal delivery service, moving
Not
in with
required.
adult children, son, daughter, retirement village.
yeah, does it matter for us?
No need.
Whether let him move with children or ladies
No.
or elderly, no need.
No
We are
need.
not bothered. The reader is not bothered. Yes.
Had respiratory infection 2 weeks ago, amoxicillin prescribed. Patient discontinued all other medication as felt unwell. Resumed medications but still only taking intermittently. Again provided education, re-importance of adherence to drug regime.
Yeah, had a respiratory infection 2 weeks, amoxicillin was prescribed. Is it relevant?
Semi-relevant.
No.
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 Not relevant because see, many of you have made a mistake. You have written in your letter, he had respiratory infection 2 weeks ago. That is referring to October 2018. Okay. But you are writing on January 22nd.
22nd.
So can you say 2 weeks ago he had a respiratory infection in the letter?
No.
No. No.
Because there's a wrong interpretation and that will hurt your grade. And this is had passed and he was prescribed, which was done, already done with. Is there a connection to the present?
No.
No, Father.
No, it is already over. So you need not bother about such expressions. So patient continued all other medications as well and resumed intermittently again, non-compliance. Do you require it? It is a repetition.
No. Repetition.
No, Father.
Again, provided again says it is not required because already we had earlier reference of educating the person. See, most of the things are irrelevant here.
22nd Jan 2019, patient and attended with daughter.
Means today, okay? You have to understand. 22nd Jan 2019 means today. As that helps you to understand the chronological order.
Patient moving to Central Village to live with daughter and her husband.
Yes, Father.
Yes, Father.
Yes, it is important because that this nullifies all other issues in the previous thing like wife cooking, all those things, because as of now he is moving with his daughter.
Daughter will cook, requires education, patient needs monitoring. Daughter advised that patient resistant to dietary alterations and medication regime. Still
Okay.
miss.
Is the requires education? Patient needs monitoring. Is it required? Daughter requires
But she
education.
is the one cooking.
Yes, yes, Father. Required.
But does it? But what is your task? What is your task?
Ongoing monitoring.
Monitoring.
The question is, two questions are: is it relevant to go carry out the ongoing care for the relevant to the present condition? Main condition is diabetes 2, and the reader needs to monitor the medication and diet. So it is, you can say, if at all need be, it is semi-relevant. Okay. This one is semi-relevant. And rape needs monitoring. Already we have mentioned it, right?
Daughter advises that patient resistant to dietary alterations and medication regime.
Again, repetition, right?
Yes, Father.
Whether daughter says or not, the fact is there already mentioned in the letter.
Still misses or double dose all medication, refuses to reduce salt, sugar, alcohol, and fatty food.
Yeah, this you can take as relevant. Okay, this has to be highlighted because this is the reluctance. Double doses sometimes, that is risky. He takes double dose, then refuses to reduce salt, all those things. Yeah, that's important. That has to be highlighted because you are asking for monitoring type 2 diabetes condition, right?
Yeah, patient continue to require monitoring and encouragement. Letter to transfer the patient to the care of the community health nurse in Centreville, where the patient is moving to live with his daughter.
Yes, so you know what type of letter it is. All those things are very clear. Actually, is there any uncertainty as regards choosing what is required? Once you understand the task, okay, and who is the reader, whom are you writing this letter to, then it's easy to find out. And you can put something in the semi-relevant area because if you don't have sufficient word count, you can use it. And as of now, as you read, you know, all this medication, current medication is repeated, right? And this is the medication which is to be taken to the notice of the reader, current medication, because he has to monitor. So wherever these things have come up in the case note below, you have to highlight these things. Okay, this should not be missed. All these things. Other than these, nothing is required. Medications, there are some other medications mentioned that is not required, which says that is not in the current medication, that's already over. That's why we said he had some issue. He was prescribed some medication that is irrelevant because that is done with. It's not continuing now. Did you get the idea?
Yes, Father.
Yes, Father.
Yes. So this is clean, crystal clear. Is
Yes,
there any
Father.
doubt regarding this? Now, by now you must be masters to do all these things. Let me have a fast glance into some things. Can you see my screen?
Yeah, Father, we can.
Yes.
Yes,
Yeah.
Father.
Yes,
Yeah.
Father.
Yeah. If I am going fast, you have to let me know. Okay. And, as I tell you always, one of the biggest enemies of your success is you are targeting B. Most of you, I tell you, you have registered yourself, you have to get a B. And, mind has its own divine power, which takes the path or takes your path for way forward. So if you target 350, you almost remain in 330, 340. I tell you, so many are getting 330, 340. I used to tell you, but I'm stressing it again. Target a grade A 450, whereby you will easily get 400. Because when you are doing a practice, you are comfortable with your 32, 33 range, 30 to 33 range of, because you say that's enough for a B grade. And you are happy when you reach there, you are content when you reach there. But if you are targeting to, out of 42, you have to get 30 or 35 or 37 or 38, then definitely you'll not be satisfied. So you'll go even harder into achieving it. So always make it a point, though I used to just glance over that and tell you always aim at A. I tell you, really you have to thirst and aim and hunger for this particular score 450, if not 500, okay? Then definitely, safely you will land in B or above B, something like 380, 390, 400. And as of now, you may not know personally, many have messaged. I think we have got 6 of them around. Some of them have called me up around more than 400 marks in reading and listening, the previous results. So some of them have 390, 380. That's a good score. All these things, I need 5 minutes, time for reading case notes, 5 minutes. There you have to identify these keywords and the sequence, which I'll be showing now. The sequence has to be identified, and you are not able to write there. But then if you identify it immediately, as soon as you get start your other time, writing time, take another 5 minutes if you want. Write down that sequence and just underline all those relevant case notes. Okay, or strike out the irrelevant, whatever the method you want to use. And time for writing the letter, don't think of 40 minutes. 25 minutes will be more than enough, and not more than 30 minutes you require to take, so that you have time to go back into the corrections. And I tell you, writing is the most easiest subtest. Reading and listening, how long you have to go, like A part, B part, C part, and C part 2 text. And, reading, you have A part, B part, C part, C part 2 text, and so many questions. And listening the same way. Speaking, okay, if you're fluent at speaking, maybe it's easier for you, otherwise you have a challenge. But writing for anyone, you need just to write 180 words. Other part, the heading, the date, address, and rail, and all those things are exactly copy and paste. There's nothing. And there are a few lines which you can even by heart. Okay. So this is the easiest one. You can finish within 25 minutes. You can write a letter if you practice well. So writing method, if you want, you can write it down. Step 1, ask yourself, does the recipient know the patient? If I have dealt with it in previous session. Only if you require, you can take them, otherwise. And if I were the recipient, what would I want to know and how would I want the information organized? Ask yourself these questions to say that is the first step. Does the recipient know the patient? And if I were the recipient, what would I want to know and how would I want the information organized? Okay, means what does help the reader in understanding the case. Okay, writing method step 2. Selecting case notes. That's what we did. What is relevant? What is semi-relevant? What is irrelevant? Okay, what is relevant? What is semi-relevant? And what is irrelevant? Relevant should not be missed. If you miss relevant case notes, you will be penalized for that. If you add irrelevant case notes, you will be penalized. And if you miss semi-relevant case notes, or if you add semi-relevant case notes, you will not be penalized, provided you don't cross the word count. 180 to 200. You can go this way or that will slightly, but we don't recommend going below 180 words, which means you have not included all the relevant data. If you go too much above 200, it means you have added irrelevant data. So it's not the word count that matters, but the fact that you have missed irrelevant data by writing less than 180 words, and you have added irrelevant data by writing more than 200 words could be penalized. It's not the word count, but these criteria are important. How to choose relevant case notes? How do you distinguish between relevant and irrelevant case note? Ask yourself two questions. Is this case note relevant to the current situation? Will this case note affect how the reader continues care for the patient? Yes or no? If answer to both question no, not relevant. If answer to either question, any one of the questions is yes, relevant, include in your letter. Get to step 3, organizing case notes. Introduction, include main medical issue. Then you have main medical issue details in the upcoming paragraphs. Then you have secondary or tertiary or related issue, as we discussed in the case note now. Then you have the request, which is discharge plan, or it is in the management plan. This is organizing case notes. The main medical issue comes in the introductory paragraph. This is purpose in the purpose. Then main medical issue details. The very next paragraph, first body paragraph, should give the details of the main medical issue, whatever is given in the case note. Nothing else. Don't bring in secondary issues, related other tertiary issues over there. That has to go in the second body paragraph or third body paragraph as required. Then requests. This should be the organizing of case notes in simple terms. So once you have mentioned the main issue, main condition in the introductory paragraph, the paragraph where you have the purpose, then there is nothing else to think. The very next paragraph speaks about the details of that main medical condition or the issue. Coming paragraphs will have secondary and related issues, and whatever you want to mention depends whether you may have 3 paragraphs or 4 paragraphs, whatever. Then you have the request. Step 4, transforming case notes. Turning a single case note into, there is a spelling mistake, it should be INTO, into a grammatical sentence. Transforming case notes is the 4th step. These steps you have to follow in your practice. That will give you a real competency, and you will become confident to write or select the case notes or write the letter. So first one is transforming the case note. First point is turning a single case note into a grammatical sentence. Second one is combining related case note to a single case note. Means combining many, 1 or 2 or 3 or several case notes into a single sentence. So it's not case note, it's sentence. There is a mistake. It should be single sentence. Okay, which means combine a compound sentence or complex sentence or compound complex sentence. How to summarize case note into compound sentences? The skill required is your ability to summarize. For example, this is high, symbol high smoking, smokes 30 per day, alcohol on weekends, drinks 3 wine glasses at night. So you have to combine these case notes. He or she is a regular smoker. In bracket, if you can mention if it is significant. If it is very significant, you can mention 30 cigarettes per day. And there is a conjunction, drinks moderately on weekends. Just to tell you how to combine. See, simple sentence into compound sentence. She is a regular smoker. She drinks moderately on weekends. She is a regular smoker and drinks moderately on weekends. That's it. Only what you take away is the subject and add the conjunction. That's a simple way. You definitely know. But then I'm just highlighting it so that you have this in mind, these steps. Case notes, weight 86 kg, height 157 cm. Peterson concerned about weight gain of 8 kg over the last 12 months. Now, here the concern of Peterson is about the weight gain, nothing about height. Okay, so height is not relevant here. Okay, he is concerned about a weight gain of 8 kg over the last 12 months. So you have to highlight that. Now, she or he, whatever, she has gained 8 kg over the past 12 months and currently weighs 86 kg. So the case note is beautifully transformed into a sentence. What to do with the aspects of past medical history that are either normal or not very important? If at all you want to summarize, already I have told you once how to summarize those things. So many things are not, medical history is not relevant or it's not important, but then you can, if you want to mention in the context, if the context warrants, you can put it in a simple sentence, all these 1, 2, 3, 4, 5, 6, 7, 8 case notes into one simple sentence. The patient's medical history is unremarkable. And in the paragraph, paragraph structure, assessment criteria, cohesiveness, write the sentences together with the help of transitions to make a cohesive paragraph. The patient's medical history is unremarkable, but she has gained 8 kg over the last 12 months. Apart from that, she is a regular smoker, 30 cigarettes per day, and drinks moderately on weekends. See, whatever we spoke in all those case notes, you can put into a simple thing like this, 2 sentences in a paragraph with the transitions, the conjunction transitions. So there's a contrast, there's a conjunction, there's a transition. That's the beauty of it. And present perfect, progressive, you know, have been, has been, ing form of the verb. Has been, getting, has been, thinking, has been, talking. Present perfect progressive, have been or has been, ing form of the verb. When to use present perfect progressive. Okay. Repeated action that started in the past. Majority of you have mistake in this particular thing. That's why I have taken it. You know, you put the things in past tense, which where you have to use present perfect progressive. Progressive means continuous. Okay. When to use present perfect continuous. Repeated action that started in the past and continues to the present. For example, a particular medication for type 2 diabetes was started in 2016 and it is continuing even today, which means you have to use present perfect progressive. You cannot use past tense there. He was prescribed this. You cannot say that because that's over. An action that is completely over in the past that has no link to the present. So that will be a mistake because that says he is no more taking that medication. Mr. James has been taking painkillers to manage the pain, which means still today, even now, he is taking painkillers. He was taking, he is taking, he may continue taking. Okay. So that is present perfect, continuous or present perfect, progressive. If it is plural, they have been trying to conceive for the past 12 months. Means since 12 months, they have been trying. They were trying, they are trying. That's the concept. And this one also make it a point, get it clearly in your mind. Many of you make mistakes using since and for. Since for a specific time means there is a specific starting time. Without that, you cannot use since. For example, since 5 p.m. today or yesterday, since morning, since Monday, since April, since 1st of June, since 2014. So there is a specific starting time when you use since. For is for a duration of time or duration period. For 10 minutes, for an hour, keep muted for 20 minutes, or for 5 days, for 6 months, for 2 years, for 30 seconds. Okay. That has been clearly made a difference in that. Don't use them interchangeably. He has been suffering from migraines since 2010. He has been smoking 1 pack of cigarettes per day for the past 10 years. Past 10 years is the duration. Since means the starting time is mentioned and it says he is continuing till today, but we don't know about the future. So, but then for means it's a duration specific, correct. Just from this time to this time. There is a starting time, ending time. Whereas other one is only we have a specific starting time for since. Hope that is clear for you. What you have to do now, you have to take down your letter and find out whether you have made this particular mistake. And that will be great if you can put it in your learning experience. What mistakes you have realized. Now, you know, this structure, you know, one of the criteria, date, address or address date, whatever. And dear, then airline, purpose, purpose expanded. That's what I said, the main issue. Purpose will have the main issue. Purpose expanded means the main issue details are given in the very first body paragraph. In the sense, soon after the introductory paragraph, which means the second paragraph of your body of the letter. And other paragraph means subsidiary, secondary or tertiary things. Then you have request or recommendation. Okay. This is body of the letter, which is being assessed, and 180 to 200 words. All those things are very good. Sign off. And sequence. You can take the case note and maybe you can write down this if you want. Date will be there. Who are you? You have to find out all these things. Who are you? Who is the patient? Date of birth or age, whatever. Medication. Okay. Then treatment record. I'm taking this particular case note in this sequence. Then under the treatment, you have diagnosis. I told you the topic word or the keyword. Type 2 diabetes, which is the main issue, which you must mention in the introductory paragraph or the paragraph where you have the purpose. Okay, then prescription, medication. Then you have hospitalization, prescription medication. I told you that is the key concept in that particular area of the case note. Hospitalization, secondary issue, MI, and assessment. See, these are the key words you have to search for. Then management and the connection to the author. Then type of letter. Okay, writing task. This is the order in the case note. And to whom. Writing task tells you who, whom, what is the task, and what is the address. This is the sequence. Once again, I want to imprint in your mind. This is very, very important. Once you get it clearly, you can easily go through date, who are you, who is the patient, date of birth, medication. Okay, this is the sequence. And then you have to find out the diagnosis, to type diagnosis, prescription, medication, hospitalization, secondary issue assessment, management, the type of letter, writing task, to whom, and what is the task, and what is the address. So this is the sequence. So you have all these things. You must identify these things. If you are thorough with this sequence, as you go on reading, easy to identify what is relevant and what is not relevant. So try to identify those things. Okay, in the reading task, there are 5 R. First, foreseeing, inquiring, then reading. That's what we are explaining now. In the task, you have to say who you are writing to, what is their job role or designation, writing task. Last portion of the case note that you know. What is your role, your role in the patient's care in the beginning of the case note. Soon after the date, you will find this. What type of letter are you writing? Purpose of the letter. Discharge plan. You will find it in the discharge plan. Most recent information. Almost like most of the time, it is the date of the examination or a date of your letter. And just above the writing task that we have already seen. And introduction, you know, what are the things should be there? Initiation. I am writing to refer, I am writing to refer, I am writing to update, whatever. That is called initiation, that portion. Details of the patient, so and so. If you want to mention the age, those things, details of the patient. Then C2 means chief complaint, main issue. Okay. Then purpose. What are you intending? What the other one, a reader should do it. So that's the purpose. So these IPCP, these things should be there in a introductory paragraph. These are the must. These are the things that is essential minimum in your introduction. You can even summarize your introduction in 1 sentence or 2 sentences, maximum 3 sentences, never go beyond that. But then healthy is 1 or 2 sentences is the best way to write a concise introduction. Fine. And the assessment criteria, we are going into the letter fast or a glance. Then you should know this purpose immediately apparent and expanded on the body of the letter. Purpose is given in the first paragraph. Second paragraph gives the details of the main issue. Then you, till the request or recommendation, you have the purpose being explained or expanded. Content is appropriate to the intended reader. Key details included. No important information is missing. Conciseness and clarity. Length is appropriate. Effective summarizing. Okay, that's what I said. Summarizing, how to summarize, transforming the case notes. Organization and logical flow of information. Appropriate paragraphing, subsections well organized. Genre and style, clinical and factual details are given. Appropriate use of abbreviations, if at all there is. It's not a must. Language is accurate. No interference with the meaning. Even if you make a minor mistakes with some prepositions and all, if it doesn't change, affect the meaning, they tolerate it. But then we should be very cautious about it. Okay, any doubts as far as the thing? Now we'll be fast going into a letter. And you'll be giving me feedbacks. Then we'll be finding out assessment criteria from a smaller perspective. For TTP people, we'll have a broader perspective of the last stage. Later, we'll have a session on that. Any clarifications you want to make before I go to the letter? Okay.
Yes.
Yeah, January, all those dates, these things are not required. You know that. Just read it. Okay, someone please read it.
22nd January 2019. The Community Health Nurse Centreville. Dear
Is there any
nurse.
issue here? Is there any issue here? This is one of the letters sent to me.
Address is not complete.
Address is not there. Bro.
Address is not complete. You know?
Yes.
Yes.
That's not correct. You have to write exactly copy and paste from the address. The 2 lines are missing here. Only thing what you have to remove is the commas there in the case note. Remove the commas and write in lines exactly this way. Okay, please continue.
Dear nurse, reference Mr. Peter Dunbar, date of birth 18 March 1932.
Fine. Yes.
I am writing to transfer Mr. Peter Dunbar, who has been under our care for diabetes since 2016. He requires.
Is there any issue here? Initiation? This
I'm
is
writing.
initiation here.
I'm
Are you
writing.
writing to transfer?
Into refer.
You are asking the reader to transfer somebody? Or?
No,
Transfer
Father.
letter. Transfer letter.
Okay. Transfer letter, but this means you are writing to refer.
It's not transfer.
Okay. Now we are not going into the corrections now. We will just highlight the problems. Okay. Then we will get into the corrections. Okay. That will be fine. Otherwise, it will take longer time. Is that fine?
Yes, Father.
Yes.
Yes, Father.
Okay. Yeah.
I am writing to transfer
Now,
Mr. Peter.
That is
Peter
not,
Dunbar.
initiation is not correct. Mr. Peter Dunbar, there are options like once you have written in the rail line, Mr. Peter Dunbar, the full name, you can even say Mr. Dunbar.
Mr.
If
Dunbar.
you say Mr. Peter Dunbar, it's not be penalized, but you have all the rights to say Mr. Dunbar if you have too many of words in your letter. Okay, Mr. Dunbar.
Who has been under our care for diabetes since 2016.
Is it okay?
He,
Do you need to say he is
under
your
our
care?
care, no need.
No, Father. Because it's understood in the context itself. It is understood he was under your care. All those details are not required. Okay.
He requires ongoing monitoring and encouragement to follow the medication regime since he decided to stay with his daughter in Centerville.
To follow the medication regime. Is it to follow the medication regime?
No.
To follow is not to adhere. To adhere or something of that other word. We'll look into it. And since he decided to stay with his daughter, he needs this monitoring all these things because she is staying with his daughter, right? Otherwise, don't require.
No, he requires.
This means this sentence almost means like since he decided to stay with his daughter.
Yes.
Is it because he is staying with his daughter? She needs all this ongoing monitoring and encouragement. If he was staying with his son, he would not have required, right?
No, he requires for
No,
it.
He is
See,
shifting.
No,
He
Father.
requires. He requires
He
for
is-
So
his
the meaning says because he is staying with since he is staying with his daughter in Centerville or in Delhi or in Bombay, he requires. If he's staying in Bangalore with his son, he doesn't require. So there is some issue there, right?
Yes, Father.
Yes.
Yeah, we will correct it, but then we will first go just to identify what is the issue. Okay, to get the nuances of the language. Yes, please continue.
Initially, Mr. Dunbar's sugar level was controlled with diabetic diet and exercise. Subsequently, he was not.
This given in the case note?
No.
Yes, not given.
This is our assumption. Assumption should not happen.
Yes.
Assumption. See, it takes time. Otherwise, correction should be done like this, you know. If you don't know how to, especially those who are getting into TTP, if you don't know TTP, you have to write here the correct version. Okay, here you can type. I am, what is it? Instead of transfer,
I'm writing to
what is in your letter?
refer Mr. Peter Dunbar.
Introduce. Whatever you want.
Or
introduce now. He was in their care, right?
You can also
You can update. Yes, whatever. Just I showed you. That takes time. That's why we are not going. I have done it. I'll show you to save the time because I knew today's will be little lengthier. So we'll go back. Yes. Then
subsequently, he was non-compliant with diet and exercise, as well as depressed following his wife's demise.
Subsequently to what?
Yeah, incomplete.
Subsequently, there is nothing. Then you cannot immediately say subsequently. Then if you put a comma here, you cannot put a capital here.
Yes.
Yes. He was non-compliant with diet and exercise.
Exercise as well as.
No, he can say he was non-compliant with his diet and exercise following his wife's demise. That's fine.
Yes.
Okay, but then, you know, what are you supposed to give in this paragraph? After the purpose, you are supposed to give the details of the main medical issue. Clearly, the details of the main medical issue should be given here. Do you have the main medical issue in the purpose?
Yes.
You don't have the main medical issue at all in the purpose. And you know, in my session, I have given the templates on column what you have to write. Even now I showed initiation. Then you should have the next one, details of the patient. Then you should have the purpose, main medical issue. Everything is given in columns as if we teach the primary school students. Still, if you are not able to practice that, one thing could be your incompetency, but much more than that, I feel you are just into writing, you are not bothered about customizing your letter. We want you to write the same letter 5 times or 10 times so that you have a grade letter at the end. Instead of writing 10 different letters, write one letter 10 times, customize it, correct it. Okay, in the discussions, you get corrected. These days, you have having sessions and you are getting corrected. Do it make sense?
Yes.
Yes, sir.
And
Yes, Father.
Yes, Father. Yes, Father.
why no improvement is happening?
He
Continue.
has been prescribed metformin since 2018. However, he takes medication intermittently and blames poor memory. Therefore, he was educated regarding the need for regular medication and the potential effects of intermittent doses, as well as strategies of memory aids.
Yeah, now this is not relevant, right? Because already we have to mention that in spite of all our struggles, we educated, whatever we did, at the end, the result is that he is still not compliant with the medication, right? Non-compliance. So ultimately, this can be added some other place, not here. At the end, you can mention it.
Since October 2018, Mr. Dunbar experiencing signs of diabetic neuropathy and poor exercise tolerance. Currently, he has restricted mobility and walks with a walking stick. Apart from that, he is resistant to diet alterations and medication regimes.
Yeah, so now already we have it here. Again, you need not. This will be a repetition if you have it there. This is the tertiary issue, secondary issue, right?
Yes,
Diabetic neuropathy is the secondary issue.
There's a third.
The tertiary issue, right?
Yeah, secondary is yes, MI, third is complications.
Okay. Now you see, June is here. This is a secondary issue.
Yes.
Yes, Father. This is the
Yes.
one.
There should have been coming here, okay?
Yes.
Yeah.
Before
the top.
this. Yeah,
Before
secondary
October.
should come, then only tertiary, or in the same paragraph, you can club with secondary and tertiary. So,
Yes.
yeah, could you read this, Mr. Dunbar?
Mr. Dunbar had hospitalization in June 2018 due to myocardial infarction, followed by atrial fibrillation, which was treated with sotalol and warfarin.
Sometimes it can be, if it is very small paragraph, secondary and tertiary issue can be clubbed, okay, in the same paragraph. Yes.
In the light of the above,
And
it would be appreciated.
Never ever use this, okay? This has no meaning here. In the light of the above, is not required at all. It is understood there.
It would be appreciated if you could provide appropriate care for Mr. Dunbar. Please note that his daughter needs education about his needs and monitoring.
This is not in the task, okay? Right? It's not in your task.
Please do not hesitate to contact me if you have any queries regarding Mr. Dunbar.
That is clear. Then let me take one step further. Here, one thing I wanted to tell you. This, can you see my screen?
Yes, Father.
Yes, Father.
Yeah.
Yes,
Yes,
Father.
Father.
I am writing to refer, transfer. Instead of that, you can write, I am writing regarding. Okay. This is how we in the TTP will have to correct. See here, your address I have written, copy and paste the address as it is given in the case notes. That is the writing task in the case note. In the bracket, remove the comma. Okay. From the case note, what you have to do is only to remove the comma. And here purpose, you are writing the letter in the context of transfer, and writing is not to transfer. Okay. So you can't use the word transfer. Mr. Peter Dunbar, like since you have mentioned full name in the ray line, you can refer using the surname here if need be. And under our care, this is understood in the context and not relevant in the purpose para. It is being transferred to your community health care. If you want to, you can write that way. And for diabetes since 2016 is not required. He requires ongoing or regular, whatever you can write, regular monitoring of his diabetes and encouragement to follow encouragement to follow. What is regular? Monitoring could be a more appropriate word in the context of irregularity in compliance with the medication. So ongoing encouragement to comply with his medication. Instead of follow, you can use the comply or adhere with his medication. And dietary regimen. Both of the regimens in the previous letter which we saw that mentioned only medication, not the dietary regimen. This both should be mentioned. Since he decided to stay with his daughter, and that's not required. He is moving to Centerville to live with his daughter. If need be, as a last sentence, small sentence, you can put in the purpose. But if not that essential, you can mention it in the last paragraph as well. Okay, body paragraph, primary issue. I am giving a thing, CIMA or TIMA you can write. Okay, how you have to construct a paragraph. C stands for chronology, there should be time. Then I stands for issue, main issue, secondary issue, tertiary issue, or the diagnosis, whatever you want to say. M stands for medication. A stands for assessment. In which year or date, what was the issue, what was the medication or the prescriptions prescribed, medication prescribed, then what was the assessment. Here assessment is not compliant with the medication. CIMA, chronology, issue, medication, assessment. These aspects should be there in your paragraph. So it becomes very easy to construct the paragraph. So here you see diagnosed with diabetes. So order can change. In August 2016, you can start with, then it becomes chronology or the time aspect, or it is here. Main issue is diagnosed with diabetes. And what is the medication? Metformin, and through diet. That is a medication or the whatever the prescription. Then resistant, that is assessment. He is resistant to medication, that is and not being compliant, and sometimes double doses, consumes excessive amount of alcohol. This comes as the assessment. Is that clear to you?
Yes, Father.
Yes, Father.
Yeah, have this format in your mind. This is not a template. This I am giving you the exact assessment. This is not template. You can have your flexibility in changing the order anyway, but then these 4 aspects should be there in your second paragraph. That is after the introductory paragraph. If you call introduction as the first paragraph, second paragraph, main issue, this CIMA about the main issue. So, you are not missing anything in the paragraph. So this was the paragraph which I written in a different way here, removing all these irrelevant things. And secondary, body paragraph 2, secondary issue. Okay, again, CIMA. In June 2018 is the chronology of the time expression. Mr. Dunbar was diagnosed with atrial fibrillation, and that is the issue. Then coronal infarction followed by atrial fibrillation. Yeah, medication is here, sotalol and warfarin. This is the medication. Then Mr. Dunbar started to show signs of diabetic neuropathy. That is the assessment. You are getting me right? Right of the above is not required. It would be appreciated if you put all those things. Yeah, that is, we have seen it. Now coming back to this. See, this is 199 words. When it's corrected, this essay is 199 words. See the purpose, the main purpose of the letter is clearly stated at the beginning of the letter and explained later in the letter. Means expanded. It is apparent here, very clear in the first paragraph, and it is explained throughout the essay. The main purpose is explained. Only those things which are relevant to expand the main purpose should be included in the letter, including the request or recommendation paragraph should speak of our main purpose. It is the expansion. The whole letter is the expansion or explanation of the purpose. There is a criteria. Second criteria is about content. Included relevant information. You should include all the relevant information. If you miss some information, relevant information, you'll be penalized. Needed by the reader to complete the required regular monitoring, and there is a clear request for action at the end of the letter. And the request for the action will be crystal clear what the reader is supposed to do. And content, timeline also comes under content, is fairly clear, but some diagnosed with the following myocardial infarction. Clear use of tenses to communicate the message. Key information about the medication. Diabetes is included. So these are things. Content is being at the assessment criteria. Relevant, all the relevant information is given, and a clear request is made. Timeline is properly used. Tenses are used properly, and medication informations are given in a clear way. And conciseness and clarity. No irrelevancies and repetition. There should not be irrelevant case notes included. That will go against this assessment criteria, and there should not be repetitions. Same thing, which distracts the reader from focusing on the main issue and action to be taken. Fairly clear summarizing of the case notes. I told you, summarizing of the case notes, combining different case notes into a compound sentence or a complex sentence or a compound complex sentence. And sometimes some case notes you can write in simple sentence as well. And also conciseness and clarity includes fairly clear summarizing of the case notes, then ideas presented in a concise and clear manner. Ideas are clear in the manner given. For example, I told you, The construction should be clear. And and style is generally appropriate use of language. No, like inappropriate use means, for example, if you use the word patient, say things, or judgmental expressions. For example, you say his dietary regimen is unhealthy, or you should, in the recommendation paragraph, many of you have written, you have to encourage him for a healthier lifestyle. That is judgmental. You have to encourage him to adhere to the recommended diet and medication, or dietary and medication regimen. That is fine. That looks polite. So don't use inappropriate language like judgmental expressions. Most of you have used that judgmental expression in the request. Organization and layout. Layout is fine, and the paragraphs are clear, making the key information easier to find. That's why I said introduction, the main issue in the introduction, then main issue explained in the very next paragraph, and secondary issue, tertiary issue, request paragraph. CIMA format. Time, impression, issue, medication or prescription, then in this format, every section should show this organization will count on that, this criteria. Logical organization of the information is given by grouping together about the diabetes and non-compliance to the recommended treatment. The things are grouped together. Informations are put into logical organization. As I said, CIMA, if you follow that, that becomes very logical development of a paragraph. Information given about the secondary and tertiary medical conditions in a separate paragraph. May not be two separate paragraphs. If you want, if there are more information, you can make it two, or you can go into one paragraph combining both secondary and tertiary medical issues if there are. Sometimes you can have only main medical issue or a secondary issue. This is fine. Request for action is clearly given in a separate paragraph. The request paragraph should be very clear. And language is another criteria. No major grammar mistakes causing strain to the reader. Grammar mistakes should not cause strain to the reader. Though there are some minor errors with the articles, but these errors are less intrusive. Means minor errors, if that doesn't affect the meaning of the sentence or distract the reader, that's fine. So this is it. This is 6 assessment criteria. Examiner, under the 6 categories, they will assess your letter. Yes, I know it was a bit long. Sorry for that. We could not help it. You have any clarifications, you can come on by. Was it too fast? Maybe if there are some beginners, I know it was a little fast, but then most of you are not beginners. Are you tired?
No,
Oh, Father.
Father.
Yes.
No, Father.
Yes. No, since you have always so many letters you have been writing, I wanted to give a comprehensive idea from starting from the selection of case notes and the writing of case note assessment. And for PTP, we'll be going detail into the last portion of it, how to assess a letter. Means on 6 letters, we have to take 6 copies of a letter, and each criteria we have to highlight what are the grammar mistakes. All those things. You know, when you ask somebody to correct you, ask me to correct a letter, how long it takes.
Yes.
And 90, I can tell you, I have glanced to almost all the letters that are typed and sent to me in my mail. I have not that I have corrected everything detailed, but I tell you, more than 90% of the letter, if I have to correct, I have to rewrite the whole letter, except address and other things. Any concerns? And now what I wanted to focus on, there are a lot of discussions going on during our writing sessions these days, which are not required actually. You fix to something, for example, what is the format of the letter to be written? You know there are 3 formats. I can teach you 5 formats if you want, but why should we require that? You can even cross-check with the what you call model letters, OET in the website, and find out one particular thing you fix onto it. Those things you need not discuss and get confused every time. Or rather to write the first name or second name. Make it very clear once you have referred once with the full name, then you can go with the surname. That's a principle, normal principle, not only for OET, it's a general principle followed all over the world, globally. When you speak, could you unmute your video? That's the general discipline of our platform. In the Q&A session, yeah, please unmute and have your phone in the landscape mode. Yes, you are right.
Yeah, good morning, Father. In this letter, the date is mentioned.
Okay.
Okay.
Yes.
Normally, if we write the letter, the date should be the exam date.
Usually, they will give you exactly today's date or presume the date as this. Exactly, it will be clear. Clearly, it will be given. And most of the case notes which are prepared by institutes and all that, there are a lot of confusing things. That is all to engage you. But in the exam, it is given today's date is this, or your date you have to write is this, or assume this as the date as it is written in today's case note. What is written? Assume that today's date is 22nd January 2009. It will be clearly given. Don't be confused on that. On
Okay,
the case
Father,
note, it will
thank
be
you.
clearly given.
Thank you, Father.
Yes.
Thank you, Father, for the wonderful session. What no words to say. It's like a beyond our.
You're welcome. You're welcome. It's not wonderful because I did it. All these case notes and letter writing is so wonderful and so thrilling and so nice. Whoever does it, it will be wonderful. It's really, once you really get a clear idea. But I feel you are getting into a lot of unnecessary discussion sometimes. So just typically follow one like date pattern and letter pattern and name pattern. Those are the common general rules. So when OET has given something, or even in the model letter you have something, just stick on to it. No need of discussions on that. And normally letters are not that tricky. If you go with this pattern, now for example, even in the previous case note letter, my letter correction, live correction, I gave you some idea about the sequence. Presented, then diagnosis, then prescription, then management, assessment, that criteria I gave you. Follow these criteria. Now I gave you CIMA or TINA, however you want to remember. Time, issue, medication or prescription, then assessment. Follow that in the paragraph structure. With that, you are just getting up to the logical development of a paragraph, which will be a bonus for you.
Good afternoon, Father.
Good afternoon.
My name is Anusijo. Thank you, Father, for a clear explanation regarding Peter Dunbar case note. I am looking forward all the time, Father Saleen's videos, and very happy to say I improved my OET. But I came from a vacation to India for my urgent situation. Today only I continuously attended your videos and OET writing letter. Thank you, Father, again for a wonderful explanation regarding what are the relevant, how to identify relevant and semi-relevant notes. Thank you, Father, for your good platform and everything.
Yeah, most welcome, Anusijo. You have to thank the whole people behind it. I am not the one. I am just doing a bit of it, but the whole admin panel and the empowering army are the real people who are working behind this platform.
I am very thankful to Soumya and all admin panel for wonderful effort to others to help to teach how to fall in love in OET. Thank you,
This is
Father.
a great, this is a natural great injustice done to them, because when a father is there, father is a focused person and everything, all the thanks comes to me. That's why I said, even you mentioned
Father is the captain of EduSkills.
Yeah,
All members and admin panel is supporting, and they are sharing their experience to us also.
But the captain is just sitting, others are struggling to take the platform forward. So whenever you mention in the platform, father should be last person to mention, and admin panel, empowering army, all those people need the first reference.
Thanks to thanks to EduSkills admin panel.
I did not correct you, Anusijo. I was telling as a general information for everybody. Because they are loading. Like people, all these people, many of them have taken sessions today. And Regina is taking a marathon, 8 sessions. She has completed 5, I believe. 3 more are coming in. And it takes a lot of time, to prepare PPT and all those things. But then that's a great attitude. If everybody joins hands, instead of she spending 500 hours, she need to spend only 5 hours. Everybody can spend. You can spend 10 minutes each.
I am watching all the videos from EduSkills. Thank you, Father.
Welcome. You're most welcome. Yes. And also pass it on to others. Let others get connected, because even some people who have passed the OET, after passing they call me and tell me, Father, it was very useful. You have few videos and all that. I did not have money, so that's why I did not attend your sessions. The other day somebody spoke to me saying that she was under the impression those videos are free, but my sessions will have huge cost. So she never attended my session, thinking that she has to pay. Genuinely people are ignorant. Sincerely ignorant they are. Thinking that father sessions will have to pay, they are not entering the platform sessions. So you'll have to create awareness on that. No?
Sure.
Yes.
Father,
And share it.
Good
Share
afternoon.
those videos to. Yeah.
Father, good
Share it to-
afternoon.
Yeah.
It's me,
Share.
Babida, Father. Yesterday I had some
Yes.
disturbances.
Yeah. Sure.
I'm
Yeah.
so happy to see you, Father, and I'm so thankful to you and for our EduSkills family. I don't know how to express my gratitude towards you. Anyway, I want to give you my testimony to our group. Please give me an opportunity to express my gratitude towards you, Father.
Yeah, definitely. You can.
I hope that
No.
you will give me that opportunity.
Yeah. You want a separate opportunity or you want to use now?
അച്ഛന്റെ ക്ലാസ് കേട്ടോണ്ടിരിക്കുക.
Please mute. Achanda class
Please mute
please
your-
mute. Yeah. Babita, congratulations for your success.
Thank
and
you
your
so
hard work
much,
has
Father.
paid.
Okay, Father, you know my reading score because only of you, because I got 390 for reading. That was a big score for me, Father. Actually, I was really struggling for that reading, especially part A. You know very well that how I did that video and all. Anyway, thank you so much, Father, and our backbone, Soumya, Veeni, Shalini, Jenny. I want to thank to everybody. But I think this limited time is not enough for me, Father.
Thank you, Father.
Thank you so much,
Yes,
Father.
Yes, most welcome. And see that even when even those who succeeded and all, when you mention it is not me behind the curtain, there are so many people. I am just one of them. So don't say thank you, Father. Thank you, Father. Say thank you, EduSkills family. You can mention it as thank you, EduSkills family, right? Everybody have their contribution, even those who just share the videos, who place their comments in the YouTube channel. Everybody has their own share in the growth of this family. So always see that you mention EduSkills family.
Hello,
You can
Father.
definitely. Yeah, please.
Hello, Father.
Manali.
Yes, Father, I am a beginner. Just now I started to preparing OET. And I don't know how to start. Like I am really scared. So I can write this later.
This is such a interesting thing. Why are you scared?
Because
many of them are addicted to this OET now. They can't but do it. Like it has become an addiction. They have fallen in love with OET, and many have referred to me saying that they can't sleep without reading. Sometimes I tell them after 12 hours duty, don't get into reading. You'll be exhausted. You can do on off days. Then they say without doing at least one reading, I cannot sleep. So much addicted to reading and all those things. So nothing to be scared. It's such an interesting thing.
Okay.
And you have to start. Maybe someone I invite somebody from your own experience, make a video how to start. This is a common question that I am facing. How to start, like and if somebody has at your access that particular steps on reading, I have given 10 steps for reading. You just post it in the platform so that Manali can look into it. Otherwise, you remind me, Manali. I'll post it. I'll find it and post it to you. Only thing, don't go into too much of practice. You try enjoying the practice. Start with the video, the oldest video, the first session on reading part B. From there, you can start. Then you can go into A. And in the order in the EduSkills channel, you can go in the same order. Because certain strategies in the progressive way I have taught. You just watch the video. Watching is not enough. Write down the strategies, and next time when you read, try to apply those strategies into your reading.
Okay, Father.
And first and foremost thing, you must love OET. That's the primary thing if you have to succeed.
Okay.
That is the foundation.
Yes, I'm first time watching your video today.
And literally, I don't want to mention because they don't want to mention their names as of now. There are people who are writing, who have booked the second time. They have got all B. Now they booked next exam date to get A, at least 2A they want. So have the next exam date.
Okay.
So much addictions, yeah. That is real addiction. If not 4, they want at least 2A, A grade.
Okay.
It's so interesting. It is not for OET or going abroad. I feel addicted now sometimes. So I don't want to look into the material like reading, listening, and all those things. If I start looking at it, I feel feeling it and analyzing it, and my whole time will be spent over there.
Okay.
It's so fascinating. It's so fascinating. So Manali, your smile is so great in your DP. So keep smiling when you look at the material, and OET, you have to smile in that same manner. Okay.
Thank you, Father.
Yeah, yeah.
Yes,
I don't mind you kissing the material and starting reading. Okay. Or listening. Yes. Fall in love with your materials. Yes.
Okay, Father. Thank you, Father.
Okay, Manali, you have to come here to tell me when you fall in love with OET and when you are addicted to these things. Okay.
Okay, Father.
Okay. God bless you, Mom.
Thank you, Father.
Yes.
Deepthi wants to say something.
Deepthi.
Yeah.
Good morning, Father.
Good afternoon,
Yes,
Father.
Deepthi, I saw you smiling. Yeah, CG Thomas brother. Deepthi was smiling since long, as if she wanted to speak something. Somebody identified it. Yes.
Actually, I give you thank you to Father. Actually, I was writing exam on December 4th, and I got B grade in for writing, for reading and listening. I was very much difficult in reading as well as some speaking. Speaking, I got partner with the mini. Sarah allotted a speaking partner for me. I have improved so much after it.
Okay. So
and
you can say thank you.
lot
many
of support
people.
from Soumya, Regina, Lily Maud. So much.
Yes.
If I was missed any name regarding other EduSkill Empowering Army, I don't know how to thank you to all.
It's cool. You can miss names. So whatever you say, we take it for a whole EduSkills family. And Deepthi was a very active member in the Empowering Army, and she was there prompt responding to all the things. Thank you for that on behalf of this family as well, Deepthi. So congratulations. We are all happy. Keep rocking. I can't say this is first, this is first. Depends on the task. What is the task? Who is your reader? Depends on both these aspects. What you have to write prominent. If it is only a disease condition, if you are asking for monitoring or ongoing care or anything, definitely you have to give the main issue in the purpose introductory paragraph, and the next very first paragraph should be the details of that main issue. Then there is a logical connection. Then you go into the secondary and tertiary issues. Then you, if you want, you present the present condition before the request paragraph. Then you go into request. Okay. It's crystal clear over there. The problem with these case notes is this: you cannot make a general discussion on these aspects, because it depends whom you are writing to and what is your purpose. What is the purpose of writing? Depends on that what becomes important. Now start writing. Okay, yes. Make mistakes, no issue, and don't worry at all. And make it a point. You can send it to me also, no problem. It doesn't mean that I correct every letter and give you, but then most of the letters I look into, glance into, and I write down the mistakes and I take it in the session. I am damn sure 80 to 90% of the corrections in the letters sent to me is being addressed in today's session, because I have collected, just glancing through, I can find, no, these are the issues. These are the issues. Purpose. Yes, no? Purpose, you see, when the main issue is not mentioned in the purpose doesn't come to purpose at all. And don't mix up the things. Like in one paragraph, you write all the primary, secondary issues or tertiary issues together. Don't mix up. Try to make different paragraphs. That is called the format or the layout of the letter. One assessment criteria. In every assessment criteria, in purpose, you have to get out of 3 2 marks. And all other criteria, as I told you earlier, is assessed out of 7 each criteria. You have to get a minimum of 5 to get a B. Even if you have done a wonderful letter, best letter, if you don't get 2 marks in purpose, but rest of all the criteria out of 7, you get 7, you will never get a B. That's what I said. You have to go by assessment criteria. And I have explained it. That is the first thing I did, if you remember.
Father, I'm on duty actually.
Okay. Good.
Even though I was able to attend the whole class, it was a wonderful session. Thank you so much. Those who all are listening me right now, please watch all the videos in our platform and
Yeah,
make
we
use
have
of it.
Oh, no, thank you so much. That's what I want to say.
So I'm not the owner, we are the owners.
Thank you for that. Thank you so much. We are really grateful to you. And the time you spend behind your first is really uncountable. Like I can imagine that the whole day you spent just to prepare this PPT, because until evening, late evening, you had so much of class and these things, and the late evening you started to prepare the PPT, and we don't know how much time you have spent behind of this, and really we are really grateful to you.
You're welcome.
And all these comments are behalf of the platform, and
I'm happy because some of them, recently, recently one of our aspirants, she was in a very bad condition. She had to move immediately, and she got writing 260. And some of I felt, I told her, why don't you try reevaluation? And she got 350, 90 marks in the reevaluation, 260 to 350. Other all things she had, she just wanted a 300 to go to UK, no? C+, but she got to 350.
One of my friends got the evaluation 100 marks extra. He was 290. Yes, then the evaluation he got the 390.
390. Okay, great.
Good afternoon, Father.
Yes. Good afternoon.
Father, I am Saravanan. How are you, Father?
Yes, I am good. I am good. How about you?
Father, thank you. I am fine, Father. Thank you for your wonderful session. Father, one more doubt. As you told that revaluation in writing, they are getting more than 60 or 100. How about reading?
Reading you don't get because, C, B,
if a
and
340
C
we are
is
reaching.
It's computer evaluation, B and C. Only A, part A is human evaluation, no? Examiner evaluates. So in A, you might get 1 or 2 maximum, normally. If there is a mistake, 1 or 2 or 3. But B and C, normally it is computer evaluation, there cannot be a mistake. So normally there will not be a change. But if it is 340, you have to read 350. Normally it can be tried. Sometimes it happens. Okay. But then reading, mainly because reading and listening is computer-based evaluation.
Yeah, Father, I was on mute. I couldn't unmute my video and audio during the session, and I'm afraid to leave and join because many are waiting outside. No, so I don't. So I was just listening to you, Father.
Yeah.
Then
Sometimes it has. In some sessions, I was disconnected and then I could not enter because it was full.
Yes, Father.
and somewhere then I request over the phone some people to exit for a while. Then when they exited and got entered, they are telling host has to admit you because I made some people co-host and they claimed hostship. It was telling me.
Soumya told me you leave and enter again. I told her, I know that I can't enter because that is not anyone's problem. So I can.
Yeah. But you could attend the class. There is no.
Yeah, I heard everything. Yes. Now then, after sometimes there's Soumya. Thank you, Soumya. She reminded me again. Once a few of them left, Soumya called me again and told me you leave and join. Yeah, that time also it was not there in mind. Yeah. Anyway, some of them are left now, so I can enter. Then Soumya remind me. Now you leave and then join again. You can. Then I did like that.
Father, hi, good morning, Father.
Yes, good morning. Yes.
Actually, Father, I couldn't attend completely because suddenly they called me for the vaccination. I did my vaccination right now. I came back. For the meantime, I just keep my what is this the Zoom section on. Unfortunately, I didn't do completely. Sorry, Father. If possible, could you admit in the evening session also?
Yeah, evening session I am yet to decide because almost everybody who has submitted the letter have attended now, as far as I see. Next, I have to cross-check with the list. Otherwise, we will ask them to write again. Those who have not written to write again, then we will have the second session. That will be more meaningful, I believe. Without writing, if you attend, you may not benefit much. Anyhow, I'll keep your thing in mind. I'll inform you. Okay.
Thank you, Father. Thank you
hope
so
you are
much.
Hope you are in my WhatsApp contact, right?
Yes,
Did you get
Father.
a personal link today?
Yes, Father. Yes, I got it.
Then you are in the case. I'll I'll definitely send you the link, okay, when there is
Okay.
second session. If not today, if there is today, fine. Yeah.
Further, would you, progress this, in the YouTube also? Father, hello?
Yes, yes, Veena.
Yeah, Father. Father, will you show it in the YouTube as early as possible? Because I can watch in the YouTube.
Hello, Veena, can you hear me?
Yes, Father.
Yeah.
Now I can hear.
Yeah, you can speak.
Okay, Father. Father, can I speak in Malayalam?
Yeah, no, sure.
Father, യൂട്യൂബിനകത്ത് കാണിക്കുമോ ഫാദറെ? എത്രയും പെട്ടെന്ന്
യൂട്യൂബില്
കാണിക്കുമോ? ഇത് ഇടുവോ? യൂട്യൂബിൽ ഇടുവോ?
എന്നതാ?
ഈ സെഷന്റെ റൈറ്റിംഗ് ഫാദർ അപ്ലോഡ് ചെയ്യുവോ?
ഈ സെഷനാ?
അതെ. അതെ അല്ലേ? ഓക്കെ ഫാദർ.
കാരണം നമുക്ക് ക്ലിയർ ആയിട്ട് അറിയില്ല എപ്പോഴും എഡിറ്റ് ചെയ്യാൻ സമയം കിട്ടുന്നു.
ഫാദർ, എന്റെ ഒരു ടെസ്റ്റിമോണിയെന്നും പറയാൻ കേട്ടോ. ഞാൻ കഴിഞ്ഞ എക്സാമിന് എനിക്ക് റൈറ്റിംഗ് ഒഴിച്ച് ബാക്കി എല്ലാം B സ്കോർ കിട്ടി. താങ്ക് യു സോ മച്ച് ഫാദർ. ഞാൻ ഒത്തിരി എനിക്ക് പറയാൻ വാക്കുകളില്ല, അതുപോലെ എനിക്ക് സന്തോഷമായി. കാരണം റീഡിങ് ഞാൻ ഫാദറെ, ഞാൻ പറഞ്ഞത് കഴിഞ്ഞ എക്സാമിന് എനിക്ക് റീഡിങ് 360 സ്കോർ കിട്ടിയത് ഫാദറിന്റെ ഒരു ഇതുകൊണ്ട് മാത്രം. കാരണം ഞാൻ ഒത്തിരി ട്രൈ ചെയ്തിട്ട് എനിക്ക് റീഡിങ് ഒരിക്കലും റിക്കവർ ചെയ്യാൻ പറ്റാത്ത ഒരു മൊഡ്യൂളായിരുന്നു. ഞാന് എന്താ പറഞ്ഞതെന്ന് പറഞ്ഞാൽ, എനിക്ക് കഴിഞ്ഞ എക്സാമിന് ഞാൻ 4th ഡിസംബറിന് ഞാൻ എഴുതിയ റിസൾട്ട് വന്നപ്പം റൈറ്റിംഗ് ഒഴിച്ച് ബാക്കിയെല്ലാം എനിക്ക് B സ്കോർ കിട്ടി. എനിക്ക് ഏറ്റവും ഒത്തിരി സന്തോഷം തോന്നി എനിക്ക് റീഡിങ് എനിക്ക് നല്ല സ്കോർ കിട്ടിയതുകൊണ്ടാണ്. അതായത് ഞാൻ ഒരിക്കലും പ്രതീക്ഷിച്ചല്ല. എനിക്ക് ശരിക്കും പറഞ്ഞാൽ സന്തോഷത്തിന്റെ ഒരു കണ്ണീര് കൊണ്ട് വരുന്നുണ്ട്. അതെന്താന്ന് വെച്ചാല്, ഞാൻ ആദ്യത്തെ എന്റെ എക്സാം എഴുതിയപ്പോ ഞാൻ ഒരിക്കലും വിചാരിച്ചില്ല എനിക്ക് റീഡിങ് റിക്കവർ ആവുമെന്ന്. അത്ര എനിക്ക് സന്തോഷം വന്നു. എനിക്ക് ഈ പ്രാവശ്യം എനിക്ക് 360 സ്കോർ കിട്ടിയപ്പോ അച്ഛൻ കാരണം മാത്രാട്ടോ. അതെനിക്ക് ഫാദറിന്റെ ഒറ്റ ഒരു ട്രെയിനിങ് കൊണ്ട് മാത്രം എനിക്ക് കിട്ടിയതാ.
അച്ഛൻ കാരണം മാത്രമല്ല, EduSkills ഫാമിലി കാരണമാണ്.
അതെ, EduSkills ഫാമിലി കാരണം മാത്രമാണ്. എനിക്ക് അത് ഒത്തിരി സന്തോഷമുണ്ട്. ഞാൻ ഹസ്ബൻഡിനോടും പറഞ്ഞു, എനിക്ക് ഇങ്ങനെ ഒരു പ്ലാറ്റ്ഫോം കിട്ടിയില്ലായിരുന്നെങ്കിൽ ഞാൻ മേ ബി ഐ കുഡിന്റ്. അതെനിക്ക് ഒത്തിരി ഒരു എക്സ്പീരിയൻസ്, നല്ലൊരു എക്സ്പീരിയൻസ് ആയിരുന്നു. ഞാൻ അൺഫോർച്ചുനേറ്റ്ലി എന്നോട് ആരും പറഞ്ഞതല്ല എനിക്കിത്. യൂട്യൂബ് ഞാൻ വെറുതെ ഇങ്ങനെ നോക്കിയപ്പോ എന്തെങ്കിലും കുറെ ടിപ്സ് ആൻഡ് ട്രിക്സ് ഒക്കെ കിട്ടുന്നുണ്ടെങ്കിൽ അതെനിക്ക് ഒരിക്കലും എനിക്ക് പ്രാക്ടിക്കലി അതെനിക്ക് ഫുൾഫിൽ ചെയ്യാൻ പറ്റിയിട്ടില്ല. പക്ഷെ ഇങ്ങനെ ഒരു സ്ട്രാറ്റജി കിട്ടിയപ്പോഴാണ് എനിക്കത് മനസ്സിലായത്, ഇതാണ് ശരിക്കും റീഡിങ്. ഈവൻ ഞാൻ IELTS കഴിഞ്ഞ ഒരു വ്യക്തിയാണ്. അതിൽ നിന്ന് പോലും എനിക്കത് പറ്റി. IELTSനൊന്നും എനിക്ക് കിട്ടാത്ത ഒരു OETയിൽ നിന്ന് എനിക്ക് റീഡിംഗ് സെഷനിൽ നിന്ന് കിട്ടിയത് അത് അച്ഛന്റെ ടീമിന്റെയും മാത്രം ഒരു ഹാർഡ് വർക്ക് കൊണ്ട് മാത്രമല്ല. താങ്ക് യു സോ മച്ച്.
ഹലോ, ഞാൻ ഇന്നാണ് ഫസ്റ്റ് ജോയിൻ ചെയ്യണത്. എനിക്ക് ഒരു ഐഡിയ ഇല്ല, ഞാൻ ഫസ്റ്റ് ഇന്നാണ് ജോയിൻ ചെയ്യണത്.
എല്ലാരും അങ്ങനെ ആരംഭത്തിൽ ആർക്കും ഐഡിയ ഉണ്ടാകിയല്ല, പിന്നെ നല്ല ഐഡിയാസ് ആയി വരും.
മീൻസ് മുൻപ് എക്സ്പീരിയൻസ് ഒന്നും ഇല്ല, എവിടെയും ജോയിൻ ചെയ്തിട്ടില്ല, യൂട്യൂബിൽ ഇങ്ങനെ ജസ്റ്റ് കാണുന്നേ ഉള്ളൂ. താങ്ക് യു സോ മച്ച് ഫോർ യുവർ സപ്പോർട്ട്.
ഗുഡ് ആഫ്റ്റർനൂൺ. പേര് പറ.
മഞ്ജു സക്കറിയ.
മഞ്ജു സക്കറിയനെ എനിക്കറിയാം. ഞാൻ വേറെ ആരാണ്ട സംസാരിക്കുന്നു. മഞ്ജു എന്ത് മിണ്ടാതിരുന്ന എത്ര നേരം?
ഫാദർ, അതുകൊണ്ടാണ് മിണ്ടാൻ ഒരു ചെറിയൊരു ഹെസിറ്റേഷൻ പോലെ. ഒരു മാസത്തോളമായി ഞാൻ ഒരു ഗ്യാപ്പ് ആയി പോയി.
അതൊന്നും ഒരു പ്രശ്നമേ അല്ല. മഞ്ജു സക്കറിയ ഗ്യാപ്പ് ആയാലും ഞങ്ങളുടെ കൂടെ ഉണ്ടെന്നുള്ള ഫീലിലാണ് ഞങ്ങൾ ഇരിക്കുന്നത്.
അതെ, ഞാനിപ്പോ
ഞങ്ങളുടെ ഒരു ആക്റ്റീവ് മെമ്പർ അല്ലേ.
ഫാമിലി ഫീലിംഗ് കിട്ടിയല്ലോ എന്ന് ഞാനിങ്ങനെ വളരെ സന്തോഷത്തോടെ ഓർക്കുമായിരുന്നു.
നമ്മുടെ മഞ്ജു സക്കറിയൊക്കെ നമ്മുടെ ഏറ്റവും ആക്റ്റീവ് മെമ്പേഴ്സിൽ ഒരാളല്ലേ. അപ്പൊ പിന്നെ ഒരു ഗ്യാപ്പ് വീണാലൊന്നും പോവില്ല, നിങ്ങൾ പറഞ്ഞു വിടൂല അങ്ങനെ.
പക്ഷെ ഞാൻ സ്വന്തമായിട്ട് അങ്ങനെ അയ്യോ EduSkillsനെ ഒത്തിരി മിസ്സാവുന്നല്ലോ ഇങ്ങനെ വിചാരിച്ചിരിക്കുമായിരുന്നു. പക്ഷെ ഇന്ന് ആ സങ്കടം അങ്ങ് മാറിക്കിട്ടി.
പിന്നല്ല. വെൽക്കം ബാക്ക് ടു ദ ഫാമിലി.
താങ്ക് യു.
വെക്കേഷന്
പോയതല്ല, വെക്കേഷൻ ആൾക്കാർ വന്നിട്ടുണ്ട്, അതുകൊണ്ട് തിരക്കായി.
അല്ലല്ല, ഞാൻ തമാശ തന്നെ. ഫാമിലിന്ന് വെക്കേഷൻ പോകുമ്പോഴല്ലേ നമ്മൾ അകന്നു പോകുന്നേ. വെക്കേഷൻ കഴിഞ്ഞ് തിരിച്ചു
അല്ലല്ല, ഫാമിലിക്കാര് വെക്കേഷന് വന്നിട്ടുണ്ട്, അപ്പൊ അങ്ങനെ ഇച്ചിരി തിരക്കായി.
അങ്ങനെ
മനസ്സിലായി.
മഞ്ജു പോയ സമയം കൊണ്ട് EduSkills ഇപ്പൊ എനിക്ക് സെഷൻ എടുക്കാൻ സമയം കിട്ടാതെ ആയി. കംപ്ലീറ്റ് ആക്റ്റീവ് ആയി. കംപ്ലീറ്റ് ഞാൻ സ്ലോട്ട് നോക്കിയിരിക്കും.
സൂമിൽ ഇന്ന ആ സമയം കിട്ടുന്നില്ല, പക്ഷെ എല്ലാം ഇങ്ങനെ കാണുന്നുണ്ട്, യൂട്യൂബിൽ വാച്ച് ചെയ്യുന്നുണ്ട്, പക്ഷെ ഒന്ന് ഇരുന്നൊന്ന് ഫോളോ ചെയ്യാൻ പറ്റുന്നില്ല എന്നേ ഉള്ളൂ. എല്ലാം അറിയുന്നുണ്ട്.
പിന്നല്ല,
അങ്ങനെ വിട്ടു പോകാൻ പറ്റത്തില്ലല്ലോ. ഇങ്ങനെ അയ്യോ എന്തായി EduSkillsൽ എന്താ നടക്കുന്നതെന്നൊരു ഒരു ആകാംക്ഷ.
എന്നാലും രാവിലെ ഞങ്ങൾ മഞ്ജുവിന്റെ സൗണ്ട് കേൾക്കുന്നുണ്ട് പ്രയറിന്റെ കൂട്ടത്തിലൊക്കെ.
EduSkills അതല്ലേ, അതുകൊണ്ടല്ലേ പറഞ്ഞ ഞാനിപ്പോ സാറായും രജീനയും ഷൂട്ട് ചെയ്തപ്പോ കുറെ അടുത്ത് അവരൊരു 4-5 അടുത്ത് രണ്ടുപേരും മാറി മാറി പറയുന്നുണ്ടായിരുന്നു, അത് സലീൻ ഈസ് ദ ഓണർ ഓഫ് ദിസ് പ്ലാറ്റ്ഫോം. അതെല്ലാം ഞാൻ കട്ട് ചെയ്ത് കളഞ്ഞു. വി ആർ ദ ഓണേഴ്സ്. അങ്ങനെ ഞാനിപ്പോ ജസ്റ്റ് ഒന്ന് പുറകെ നിൽക്കുന്നേ ഉള്ളൂ. ബാക്കി എല്ലാം പ്ലാറ്റ്ഫോം EduSkills ഫാമിലിയാണ് വർക്ക്ഔട്ട് ചെയ്യണേ. അങ്ങനെ പോണം. ഞാനില്ലെങ്കിൽ ഈ പ്ലാറ്റ്ഫോം റണ്ണാകണം.
അത് ശരിയാച്ചാ. കുതിര തളിക്കുന്ന ആൾക്കാരെ കണ്ടിട്ടില്ലേ? അവര് ജസ്റ്റ് ആ ഒരു ചരട് അവര് പിടിക്കത്തേ ഉള്ളൂ.
ഗോളടിച്ചല്ലോ.
ഗോളടിച്ചു.
അവര് ആ റോപ്പിൽ ജസ്റ്റ് ഒന്ന് പിടിക്കത്തുള്ളൂ. അതിലാണ് ആ കൺട്രോള് മൊത്തം.
ഇത് മിണ്ടാപ്പ് വെച്ച കല പിടിച്ചെന്ന് പറഞ്ഞ പോലെ മിണ്ടാതിരുന്നിട്ട് അവസാനം ഗോളടിച്ചു.
നേരത്തെ പറഞ്ഞ പോലെ എന്റെ കണ്ണീന്ന് so blessed. Something is there to control.
ഇതൊക്കെ തമ്പുരാന്റെ ദൈവത്തിന്റെ പദ്ധതിയല്ലേ? അല്ലെങ്കിൽ ഇപ്പൊ എവിടെയൊക്കെ കിടക്കുന്ന ആൾക്കാർ കണ്ടില്ലേ? ഒരു ഫാമിലി ആയിട്ട് ഇതിലേ കിടക്കുന്നു, എവിടെ കിടക്കുന്നു, ആര് എന്ത് ഒരു പിടിയും കിട്ടാത്തവര്. സാറപ്പോളിന്റെ അനക്കമില്ലല്ലോ. ഒക്കെ എന്നാ പറ്റി? ഡ്യൂട്ടിയാണോ? നിങ്ങൾക്കൊക്കെ OET കുറഞ്ഞു കിട്ടരുത്. ഇനി കുറഞ്ഞു കിട്ടിയാൽ അതൊരു സുഖമില്ല. അത് OET ആണെന്ന് പരിഗണിക്കാൻ പറ്റില്ല.
എനിക്കൊരു എല്ലാരും ഡ്യൂട്ടി ഒക്കെ ചെയ്യുന്നവരാണോ, വർക്ക് ചെയ്യുന്നവരാണോ എല്ലാരും?
അതെയോ,
അത് ചോദിച്ചത് ആരായിരുന്നു? ഒന്ന് പറയോ?
വീണ.
വീണയല്ല, വീണയാണ് ചോദിച്ചല്ല. വീണനെ കാണുന്നില്ല. വീണയാണ് ചോദിച്ചേ. ഓക്കെ. മിക്കവരും ഭൂരിപക്ഷം ജോലി ചെയ്യുന്നവരാ. ഈ റെജിനയൊക്കെ ഫുള്ള് ജോലി ചെയ്ത് പിള്ളേരെ കാര്യം നോക്കി, ഹസ്ബൻഡിന്റെ കാര്യം നോക്കി, വീട്ടിലെ പണി നോക്കി, എന്നിട്ടാണ് ഈ പറയുന്ന മാരത്തോൺ സെഷൻസ് ഒക്കെ നടത്തുന്നത്.
ഞാനുണ്ടല്ലോ, ഞാൻ അച്ഛന് അതിനു മുമ്പ് വീഡിയോ എഡിറ്റ് ചെയ്ത കാര്യം പറഞ്ഞപ്പോ ഞാൻ ആലോചിച്ചത്, അതിനകത്ത് ഇട്ടിരുന്ന സൗണ്ട് ഒക്കെ ഞാൻ അഡീഷണൽ ഓഡിയോ കയറ്റിയപ്പോ എന്റെ സൗണ്ട് ഒക്കെ നൈറ്റ് ഡ്യൂട്ടി കഴിഞ്ഞിട്ടുള്ള ഒരു ഹാങ് ഓവർ ആ സൗണ്ടിൽ നല്ല പോലെ വന്നിട്ടുണ്ട്. എനിക്ക് സ്ലീപ്പി മൂഡിലാണ് ഞാൻ ഓഡിയോ എഡിറ്റ് ചെയ്യുന്നത്. അപ്പൊ അതെങ്ങനെ ആകുമെന്ന് ഞാനിങ്ങനെ ചിന്തിച്ചുകൊണ്ടിരിക്കുമ്പോഴാണ് എനിക്ക് വീണ ചോദിക്കുന്നത്. നമ്മളെല്ലാവരും ഡ്യൂട്ടി ചെയ്തിട്ടാണ് ചെയ്യുന്നത്.
അയ്യോ, താങ്ക് ഗോഡ്. എല്ലാരും ആക്റ്റീവാ. ഞാൻ എപ്പോഴും ഓർക്കും ചെയ്യുന്ന ഇവർക്കൊന്നും ജോലി ഇല്ലാതായിട്ടായിരിക്കും ഇവർക്ക് ചെയ്യുന്നത്. ഞാനിവിടെ സത്യം പറഞ്ഞാൽ ഇന്നൊരു ലീവാ. എനിക്കറിയത്തില്ലായിരുന്നു. ഞാൻ സംശയം കൊണ്ട് ചോദിച്ചതാ.
വീണ നമുക്കുണ്ടല്ലോ, ഫോർ എക്സാമ്പിൾ എന്റെ കാര്യം തന്നെ പറയാം. എനിക്ക് നേരത്തെ എനിക്ക് ഇതുപോലെ ബിസി ആയിരുന്നു. അന്നും എനിക്ക് സമയമില്ലായിരുന്നു. ഇപ്പോഴും ഇത്ര സമയമുള്ളൂ. പക്ഷെ ആ ഉള്ള സമയത്തിൽ നമ്മൾ മാക്സിമം നമുക്ക് എന്ത് ചെയ്യാൻ പറ്റും അത് ചെയ്തു തുടങ്ങുമ്പോൾ നമുക്ക് വീണ്ടും ചെയ്യണം. മറ്റുള്ളവർക്ക് വേണ്ടി എന്തെങ്കിലും ചെയ്യണമെന്നുള്ള ഒരു ഇത് വരണുള്ളൂ. അപ്പൊ ഒന്ന് ചെയ്തു തുടങ്ങിയോ. വീണ ഇനി നമുക്ക് വേണ്ടി വർക്ക് ചെയ്തോളൂ. അപ്പം അത് ഓട്ടോമാറ്റിക് ആയിട്ട് വന്നോളൂ.
അതെ, എനിക്ക്
പിള്ളേരെല്ലാം അതിന്റെ വീണയെ പോലെ തന്നെ പിള്ളേരെല്ലാം അതുപോലെ അവിടെ ഇങ്ങനെ നമ്മുടെ കൂടെ ഇങ്ങ് പൊക്കോളും. അപ്പൊ നമ്മളും മറ്റുള്ളവർക്ക് ബെനിഫിറ്റ് ആവുമെന്ന് തോന്നുമ്പോ അങ്ങ് ചെയ്തു തുടങ്ങിക്കോളും.
അതിനുള്ള ഒരു കേപ്പബിലിറ്റി ഉണ്ടോ എനിക്ക്? ശരിക്കും പറഞ്ഞാൽ ഒരു ടീച്ചിങ് അതൊരു ഭയങ്കര ബ്ലെസ്സിങ് ആണ്. എനിക്ക് അതിനുള്ള ഒരു കഴിവുണ്ടോന്ന് എനിക്ക് അറിയത്തില്ല.
വീണ ഒരു പോയിന്റ് ഇട്ടാൽ മതി. വീണ ഒരു പോയിന്റ് ഇടുമ്പോ അച്ഛൻ 10 എണ്ണം ഇങ്ങോട്ട് ഇട്ട് തരും ഒന്ന് മോട്ടിവേറ്റ് ചെയ്യാൻ വേണ്ടി. അപ്പൊ പിന്നെ ഓട്ടോമാറ്റിക് ആയിട്ട് വീണ ബൂസ്റ്റപ്പ് ആയിക്കോളും. മാത്രമുള്ള ഒരു കഴിവാണ്.
അതെ 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 അത് കഴിവ്. ഞാൻ ഒത്തിരി വാച്ച് ചെയ്യുന്നുണ്ട്. എങ്ങനെയാ നിങ്ങൾ പ്രസന്റ് ചെയ്യുന്ന പ്രസന്റേഷൻ ഒക്കെ ഒത്തിരി നോക്കാറുണ്ട്. എനിക്കൊരു ചമ്മൽ, ഒരു മടി.
ഈ ബി ഒക്കെ കിട്ടിയ ആൾ ഓഫ്കോഴ്സ്
അതറിയില്ല, ദൈവം എനിക്ക് തന്നാന്ന് തോന്നുന്നു. റൈറ്റിങ്ങിന് അങ്ങനെ ഞാൻ ആദ്യമായിട്ട് സൂം സെഷനിൽ കയറുന്നത് പോലും. എനിക്ക് ഇന്നേ വരെ എനിക്ക് അതിനുള്ള ഒരു അവസരം കിട്ടിയില്ല. ഡ്യൂട്ടി ആയിരിക്കും, അല്ലെങ്കിൽ ഓൾറെഡി എല്ലാരും കയറി ഫുൾ ഒക്കുപേഡ് ആയിരുന്നു. ഇങ്ങനെ ആദ്യമായിട്ടാ സൂം സെഷൻ. ഒത്തിരി എനിക്ക് ഭയങ്കര ഇഷ്ടപ്പെട്ടു. അപ്പൊ
നമ്മുടെ പ്ലാറ്റ്ഫോമിനോടുള്ള സ്നേഹ, ഭയങ്കര സ്നേഹം. നാസസ് അല്ലേ, നമ്മളെ നാസസ് ആയിരിക്കും. നമ്മള് ഒരുമിച്ച് നമുക്ക് വേണ്ടി വർക്ക് ചെയ്യാം.
ശരിക്കും ഇതുപോലെ ഈ രചനയൊക്കെ സ്നേഹിക്കുന്ന പോലെ അതിന്റെ ഒരു 10-1 എല്ലാരും അങ്ങ് സ്നേഹിച്ചാൽ, ഒരു പകുതി പേരങ്ങ് സ്നേഹിച്ചാൽ ഈ ലോകം മാറ്റിയെടുക്കാറ് നമുക്ക്. നേഴ്സുമാർ ഒരാൾ പോലും ഈ OETക്ക് വേണ്ടി സ്ട്രഗിൾ ചെയ്യാത്ത ഒരു അവസ്ഥയിലേക്ക് നമുക്ക് കൊണ്ടുവരാറുണ്ട്.
അതെ, എത്ര പേരാ.
എന്ത് എളുപ്പമെന്നറിയാം. ഇപ്പൊ ഞാൻ പറയണ ഇത്രയും ആൾക്കാരുണ്ടല്ലോ, ആയിരക്കണക്കിന്. അതിനകത്തൊരു 10-200 പേരൊന്ന് മനസ്സ് വെച്ചാല് നമുക്ക് ഇതിനെ ഏത് ലെവലിലും കൊണ്ടുപോയി ഒരാൾ പോലും OETക്ക് ബുദ്ധിമുട്ടാത്ത രീതിയിൽ ഒരു പൈസ മുടക്കാതെ ഈ ലോകത്തിലുള്ള മുഴുവൻ നേഴ്സുമാർ OET എഴുതിയെടുക്കുന്ന ഒരു അവസ്ഥയിലേക്ക് നമുക്ക് കൊണ്ടുപോകാൻ പറ്റും. ഒരു 200 പേര് മനസ്സ് വെച്ചാൽ മതി. ലോകത്തിൽ ഒരാൾ പോലും ആവശ്യമില്ലാണ്ട് ഈ OETക്ക് വേണ്ടി സ്ട്രഗിൾ ചെയ്ത് പൈസയും കളഞ്ഞ്
മനസ്സ് വെച്ചോണ്ടാണ് ഞങ്ങൾക്ക് വരാൻ പറ്റിയത്.
കേട്ടില്ല.
അച്ഛനൊരാളും ഇനിഷ്യേറ്റ് ചെയ്തുകൊണ്ടാണ് ഞങ്ങൾക്ക് ഇങ്ങനെ വരാൻ പറ്റിയത്. സാധാരണ ഏത് ഇവിടെ ചോദിച്ചാലും ഭയങ്കര റേറ്റ് അവർ പറയുന്നത്. അപ്പൊ ഒരു മാസത്തേക്കൊക്കെ ഞങ്ങളെപ്പോലെ ഈ മസ്കറ്റ് ജോലി ചെയ്യുന്നവർക്കൊക്കെ ഭയങ്കര പാടാ ഒരു റെഗുലർ ആയിട്ടൊരു ക്ലാസ് അറ്റൻഡ് ചെയ്യാനായിട്ട്. അപ്പൊ ഇതുപോലെയുള്ള പ്ലാറ്റ്ഫോമിലാണെങ്കിൽ റെക്കോർഡഡ് ആണെങ്കിലും ഒന്ന് കേൾക്കാൻ പറ്റുന്നുണ്ട്. ലൈവ് പറ്റുന്ന സമയത്ത് കയറാൻ പറ്റും, അല്ലാത്ത സമയത്തൊക്കെ ലൈവായിട്ട് എവിടെയെങ്കിലും ഒക്കെ കയറുന്ന സമയത്ത് കയറാം. ഇല്ലാന്നുണ്ടെങ്കിൽ റെക്കോർഡഡ് ക്ലാസ്സുകൾ മാത്രം കേൾക്കാൻ പറ്റുള്ളൂ.
അപ്പം ലോകത്തിൽ ഏതൊരു നേഴ്സിനും OET പഠിക്കണമെന്ന് തോന്നുമ്പോൾ വേറെ എവിടെയും തപ്പിപ്പോകേണ്ട ആവശ്യം വരികയില്ല. കാരണം വേറെ സംഗതി ഉണ്ട്, പഠിച്ചാൽ മതി. വീട്ടിലിരുന്നോ അവരുടെ സൗകര്യം അനുസരിച്ചോ ഇഷ്ടമുള്ളപ്പോൾ ഇഷ്ടമുള്ളതുപോലെ പഠിച്ച് കയറി പോകാവുന്നേ ഉള്ളൂ. അത്രയും കണ്ടന്റ് ഉണ്ടാക്കി നമുക്ക് അപ്ലോഡ് ചെയ്യാൻ സാധിക്കും. പക്ഷെ ആ ഒരു റിയലൈസേഷനിലേക്ക് എത്തണ്ടേ. ഹായ്, ഹൃദയായിക്കട്ടെ മോളെ, എന്നാ ഉണ്ട് വിശേഷം? സുഖാണോ?
ഞാൻ OET പഠിക്കാൻ കയറിയതുകൊണ്ട് ഇവർക്ക് ഒരു ഇമ്പ്രൂവ്മെന്റ് ഉണ്ടായി. ഇവര് റീഡിംഗ് പാസേജ് ഒക്കെ കിട്ടുമ്പോഴത്തേക്കിനും നമ്മുടെ വില്ല് ഇവിടെ കിടക്കുന്നു, വുഡ് ഇവിടെ കിടക്കുന്നു, ക്യാൻ ഇവിടെ കിടക്കുന്നു, അണ്ടർലൈൻ ചെയ്യാമേ, അണ്ടർലൈൻ ചെയ്യാമേ.
പിള്ളേരിനെ ആദ്യം OET എഴുതുവോ?
ഇപ്പോഴേ അവര് പഠിച്ചില്ല, അവര് ഉറപ്പായിട്ട് OET എഴുതിയിരിക്കും അവര്.
പിന്നെ സ്പീക്കിങ്ങിനാണേലും ആ ഒരു എന്താ പറയാ, എന്നെക്കാട്ടിലും ആ ഒരു സ്റ്റൈലൊക്കെ ഇവരുടെയാണ് കേൾക്കാൻ രസം. ഇവരാണ് അത് ഗ്രാസ്പ് ചെയ്തെടുത്തിരിക്കുന്നത്. എനിക്ക്
മിടുക്കികളാണല്ലേ, സൂപ്പർ മിടുക്കികള്. ഗുഡ് ഗുഡ് ഗുഡ്. പിന്നെ നമ്മള് കുട്ടികൾക്കുള്ള പ്രോഗ്രാം ചെറുതായിട്ടൊന്ന് തുടങ്ങിയിട്ടുണ്ട്. അതിന്റെ 1-2 വീഡിയോസ് ഇടുമ്പോ നിങ്ങളൊന്ന് സപ്പോർട്ട് ചെയ്തേക്കണം കുഞ്ഞുങ്ങളെ.
ഞാനത് കാച്ചോട് ചോദിക്കണമെന്നുണ്ടായിരുന്നു. ഇവര് ശരിക്കും കുഞ്ഞിതാണ്. ഒരാള് UKG, ഒരാള് 2nd സ്റ്റാൻഡേർഡ് ആയതേ ഉള്ളൂ. അപ്പം തീരെ കുഞ്ഞു പിള്ളേരാണ്.
കുഞ്ഞു പിള്ളേര് കുഴപ്പമൊന്നുമില്ല. നമ്മള് സ്റ്റെപ്പ് ബൈ സ്റ്റെപ്പ് അതിലേക്ക്
എന്തെങ്കിലും ആക്ടിവിറ്റീസ് ഉണ്ടോ എന്നൊക്കെ ഞാനിങ്ങനെ EduSkillsന്റെ യൂട്യൂബ് വീഡിയോസ് ഇങ്ങനെ കാണുന്ന കൂട്ടത്തിൽ പല ആക്ടിവിറ്റീസ് കണ്ടപ്പോ ഞാനിങ്ങനെ പല പ്രാവശ്യം ചോദിക്കണമെന്നുണ്ടായിരുന്നു. പിന്നെ വിചാരിച്ചു ഇവര് കുറച്ചും കൂടെ ഒന്ന് ആവട്ടെ എന്ന് വിചാരിച്ചു.
കുഴപ്പമൊന്നുമില്ല. അവർക്ക് ആക്ടിവിറ്റീസ് അതിനകത്ത് തന്നെ ഉണ്ട്. അതിനകത്ത് തന്നെ അവർക്ക് പഠിക്കാനുള്ളത് ചിലത് ഒത്തിരി വീഡിയോസ് അതിനകത്തുണ്ട്. വേണമെങ്കിൽ കൊച്ചു പിള്ളേർ ചെയ്തിരിക്കുന്ന പിന്നെ ഒരുവിധ ഹൈസ്കൂൾ ലെവലിലുള്ളവർക്ക് നമ്മൾ ചെറുതായിട്ടൊന്ന് തുടങ്ങിയിട്ടുണ്ട്. തീരെ പാവപ്പെട്ട പിള്ളേർക്കൊക്കെ ഒരു പഠിക്കാൻ ബുദ്ധിമുട്ടുള്ളവർക്ക് ഒന്ന് പഠിക്കാനുള്ള അവസ്ഥയൊക്കെ വരാൻ വേണ്ടിയിട്ട് നമ്മൾ 2-3 വീഡിയോ അടുത്ത ആഴ്ച അപ്ലോഡ് എഡിറ്റ് ചെയ്ത് ഇടാമെന്ന് പ്രതീക്ഷിക്കുന്നുണ്ട്. ഇട്ട കഴിഞ്ഞാൽ നിങ്ങളൊന്ന് പരമാവധി ഒന്ന് അവരെ സപ്പോർട്ട് ചെയ്തേരെ.
പിന്നെ ഞാൻ അകത്ത് റൂമിൽ അടച്ചിരുന്ന് ഇത് ചെയ്യുമ്പോഴത്തേക്കിന് ഇവര് പുറത്ത് നിന്ന് വേറെ മൊബൈലില് ഇംഗ്ലീഷ് പാസേജ് ടെക്സ്റ്റ് പുസ്തകമൊക്കെ നന്നായിട്ട് വായിച്ചിട്ട് എനിക്ക് സെൻഡ് ചെയ്യും. പുറത്ത് അപ്പുറത്തെ മുറിയിൽ നിന്ന് ഇപ്പുറത്തോട്ട്.
അത് EduSkillsന്റെ ബോണസ് ആണ്. EduSkill കിഡ്സ് ആണത്.
അതെ ശരിക്കും
നമുക്ക് നോക്കാം, അവർക്ക് വേണ്ടിയിട്ട് എന്തെങ്കിലും ചെയ്യാം. നമുക്ക് അവരെ നമുക്ക് ബേസിക്സ്, ഇംഗ്ലീഷിന്റെ ബേസിക്സ് പഠിപ്പിക്കാം. സൗണ്ട്സ് പഠിപ്പിച്ചു കൊടുക്കാം. ഈ പ്രായത്തിൽ പഠിച്ചാൽ പെട്ടെന്ന് പഠിച്ചോളൂ.
അത് വേണം. എന്റെ മക്കളും ഉണ്ട്, രണ്ടാം പിള്ളേർ.
ഒരു കാര്യം കൂടെ, നമ്മള് EduSkillsല് മോർ പീപ്പിൾ ആഡ് ചെയ്യുന്നത് ഞങ്ങൾ 3 പേരും കൂടി.
ആണോ? വെരി ഗുഡ്. ഓ, കൺഗ്രാചുലേഷൻസ്. താങ്ക് യു മക്കളെ.
സൺഡേയിലെ സെലിബ്രേഷൻ ഒക്കെ ഇവിടെ 14K ആയി എന്നൊക്കെ പറയുമ്പോഴേക്ക് 13K ആയി, 14K ആയി, ഇവിടെ ഭയങ്കര ഡാൻസ് ആണ്, പാട്ട്.
ഓ, വെരി ഗുഡ്, വെരി ഗുഡ്. അവരെ തീർച്ചയായിട്ടും നമ്മൾ എന്തെങ്കിലും പഠിപ്പിച്ചിരിക്കും. അവരുടെ പേര് എനിക്കൊന്ന് മെസ്സേജ് ചെയ്തേ കേട്ടോ മഞ്ജു. അവരെ ഞാൻ എന്തെങ്കിലും പഠിപ്പിച്ചിരിക്കും സ്പെഷ്യൽ ആയിട്ട് കേട്ടോ.
ഇങ്ങനെ ചില ആദ്യത്തെ 2-3 പ്രാവശ്യമൊക്കെ അടുപ്പിച്ചടുപ്പിച്ച് സൺഡേ വരുമ്പോ പറയാം, അമ്മ ഇന്ന് സൺഡേ അല്ലേ, ഇന്ന് ആഡ് ചെയ്യണ്ടേ, നമുക്ക് ഫ്രണ്ട്സിനെ ആഡ് ചെയ്യണ്ടേ.
അതാണ് ശരിക്കുള്ള EduSkill ഫാമിലിയുടെ സ്പിരിറ്റ്.
അതെ, ഞാനിപ്പോ നമ്മൾ 15 പേരില്ലേ, ഒരു കാര്യം കൂടി പറഞ്ഞോട്ടെ. ഈ എഡിറ്റിങ്ങിന്റെ കാര്യം അച്ഛൻ ഒത്തിരി സമയം അതിന്റെ പുറകിൽ സ്പെൻഡ് ചെയ്യുന്നുണ്ട്. കേൾക്കണില്ലേ? കേൾക്കണില്ലേ? അപ്പൊ സൗമ്യ ഇത്രയും നാളും സൗമ്യ ഹെൽപ്പ് ചെയ്തു. അപ്പൊ നമ്മൾ എല്ലാവരും ഇതിനകത്ത് ഹെൽപ്പ് ചെയ്യണം എഡിറ്റിങ്ങില്. കാരണം ഓരോ വീഡിയോയ്ക്കും വേണ്ടി അച്ഛൻ 5-6 hours സ്പെൻഡ് ചെയ്യുന്നുണ്ട്. അപ്പൊ നമ്മളിപ്പോ ഒരു 15 പേര് ഇവിടെ ഉണ്ട്. നമ്മൾ എപ്പോഴെങ്കിലും നമ്മൾ ഒരു വീഡിയോ എഡിറ്റ് ചെയ്ത് കൊടുത്താൽ അതൊരു ഹെൽപ്പായിരിക്കും ഫാദർ. നമുക്ക് ഇന്നലെ തന്നെ എത്ര നേരം അച്ഛൻ ഇപ്പൊ തന്നെ ഇന്നലെ ഒന്നും ഉറങ്ങാതിരുന്നാണ് ഇത്രയും ചെയ്തതെന്ന് നമുക്ക് നല്ല പോലെ അറിയാം. എന്നിട്ട് നമുക്ക് വേണ്ടി നമ്മുടെ ആ ഒരു റിലേഷൻ മെയിൻറ്റെയിൻ ചെയ്യാൻ വേണ്ടിയാണ് അച്ഛൻ ഇരിക്കുന്നത്. അപ്പോൾ വീഡിയോ എഡിറ്റിങ്ങിലൂടെ നമ്മൾ ആരെങ്കിലും ഒക്കെ പഠിച്ചിട്ട് തുടങ്ങുകയാണെങ്കിൽ ഒരു വീഡിയോ നമ്മൾ ചെയ്യുന്ന വീഡിയോ എങ്കിലും മാത്രം എഡിറ്റ് ചെയ്ത് കൊടുത്താൽ ഭയങ്കര അതൊരു സഹായമാവും നമ്മുടെ പ്ലാറ്റ്ഫോമിന് വേണ്ടി. അപ്പൊ അതിനകത്തുകൂടി നമ്മളൊന്ന് ശ്രദ്ധിച്ചാൽ, നമ്മൾ നഴ്സസിന് കഴിയാത്തതായിട്ട് ഒന്നുമില്ല. നമ്മളൊരു ചെറിയൊരു സമയം നമ്മളൊന്ന് ഉണ്ടാക്കിയാൽ മതി, നമുക്ക് അവിടെ ചെയ്യാൻ പറ്റും.
ഞാൻ ആദ്യമായിട്ടാണ്, എനിക്കൊന്നും മനസ്സിലാവുന്നില്ല.
സുജാത എന്ത് ലക്കിയാ, വേറെ ഒന്നും മൈൻഡിൽ കേറി പറ്റുന്നില്ല, കച്ചറകളൊന്നും. ശരി, ഡയറക്റ്റ് അച്ഛന്റെ സ്ട്രാറ്റജീസ് മൊത്തം ഗ്രാസ്പ് ചെയ്യാം, എന്നിട്ട് ഒറ്റ പിടിപ്പിര. ഞങ്ങൾക്കൊക്കെ ഇനി ട്രെയിൻ ചെയ്യണം കേട്ടോ.
എനിക്കൊന്നും അറിയത്തില്ല.
അതാ പറഞ്ഞേ, ഒന്നും അറിയില്ലാത്തത് കൊണ്ട് അച്ഛന്റെ സ്ട്രാറ്റജീസ് മാത്രം ഫോളോ ചെയ്യാം. അപ്പൊ അത് മാത്രല്ലേ മൈൻഡിലുള്ളൂ. ഞങ്ങളുടെ എന്ന് പറയുമ്പോൾ ഉള്ള കച്ചടകളെല്ലാം കയറി മൈൻഡിൽ കിടക്കുക, അതെല്ലാം ഡിലീറ്റ് ആയിട്ട് പക്ഷെ പിന്നെ വന്നുകൊണ്ടിരിക്കും.
നമ്പർ പറഞ്ഞോ.
960 + 960 എഴുതണേ.
ഒന്നുകൂടി പറയോ.
+960 9700 221.
ആ പ്ലസ് വേണം അല്ലേ? അത് ഇല്ലാഞ്ഞിട്ടാണോ? ഞാൻ കുറെ പ്രാവശ്യം പറഞ്ഞില്ലേ, ഞാനും സ്വാമിയെ വിളിക്കാൻ പറ്റുമ്പോഴൊന്നും എനിക്ക് പറ്റുന്നില്ല.
റെജീന അല്ലേ? ഞാൻ ആ നമ്പർ സേവ് ചെയ്ത് തന്നായിരുന്നു തോന്നുന്നു, ടൈപ്പ് ചെയ്ത് തന്നായിരുന്നു.
സെൻഡ് ചെയ്തത് പക്ഷെ എനിക്ക് പറ്റുന്നില്ലടാ. ഞാൻ പ്ലസ് ഇല്ലായിരുന്നു.
നമ്പർ കിട്ടിയോ?
സ്വാമി ഒന്നുകൂടെ പറയാമോ?
+960 കിട്ടുന്നുണ്ടോ? +960 9700 221.
ഓക്കെ കേട്ടോ. അപ്പൊ ബൈ.
ബൈ.